Let's see. To my left here is Lisa Diehl with West Virginians for Affordable Health Care. Seth DiStefano with the West Virginia Center on Budget and Policy. Cathy Reed. Sorry about that. Cathy Reed, who's the president of the Fairmont Council of Churches, and Jennifer Thacker of West Virginians. West Virginia Alliance for Sustainable Family. I was doing so well, too. The West Virginia Alliance for Sustainable Family. And we're here today to talk about an initiative of the council and the fellow members here of an initiative called Compassion Calls Us. And we're on a Compassion Caravan. And today I want to start by telling a story that Cardinal Tobin has shared about Pope Francis. It seems that a short time after Pope Francis was elected Pope, he called in the Secretary of State for the Vatican and said, "I want to go to Lampedusa." Now, Lampedusa is an island which Cardinal Tobin noted was the point of entry for refugees in Europe, but a lot of people had drowned trying to get there. Well, the Secretary of State tried to talk Pope Francis out of going, saying, "Well, you know, this is your first trip. You know, do you really want to go there?" And finally, he got Pope Francis to think about this a little bit longer. And then the next day, Pope Francis called the Secretary of State back and said, "I want to go to Lampedusa." And the Secretary of State heard the firmness in Pope Francis's voice and said, "Okay, but you know, these things take time to arrange. You know, there's a press conference and, you know, security, and maybe we could do it 6 months, you know, but maybe a year." A couple of days later, the Secretary of State received a call from the Vice President of Air Italia saying a passenger by the name of Jorge Bergoglio had booked a flight from Rome to Lampedusa. And Jorge Bergoglio was the name that Pope Francis had before he became Pope. So Pope Francis's first trip away from Rome was to Lampedusa. And when he got there, he condemned the smugglers. He thanked the people of Lampedusa for their hospitality. And then he mentioned the first two questions in the Bible that God asked. The first two questions in the Bible that God asked. Do you remember them? The first question is, "Where are you?" And the second one is, "Where is your brother?" Where are you? And that's from Genesis, when God is looking for Abraham and Eve after the fall. And the second question is to Cain about his brother Abel. Where are you? And where is your brother? And I think today we could ask, where is your sister? The Compassion Caravan grew out of various efforts of faith communities to respond to legislation proposed this spring to eliminate the Affordable Care Act and to turn Medicaid into a block grant. Concern for the people who would have been hurt by this legislation and worried that the country was losing the ability to talk about public issues from the standpoint of the common good, the West Virginia Council of Churches participated in efforts to keep the Affordable Care Act from being repealed and for Medicaid from being cut. A discussion with some of the faith partners who had participated in these efforts led to the idea of a Compassion Calls Us initiative, which would help bring our public policy debates back into the realm of asking, what does compassion call us to do? The Compassion Caravan is an effort to answer this question and to bring this question to the people of West Virginia and to raise awareness of how programs like Medicaid and SNAP help the most vulnerable among us. For a while now, the West Virginia Council of Churches has been raising the question of how we can move away from the language of ideology and the language of finances when engaging in public discourse about issues facing us, and more towards the language of the common good, which is not only theological language found in the Church, but in the United States Constitution and the West Virginia Constitution as well. How can we talk about public issues from the perspective not of ideology or of politics, but of people? What we are seeking to do is to bring back the language of value into our political discourse. Now, a lot of people talk about values, but don't name them. For the Council of Churches, those values include compassion, forgiveness, and caring for one another. And we're holding these events around the state. We're doing a little bit of education, a little bit of networking, and a lot of reflection on these issues. Where are you? And where is your brother or your sister? And so we want to talk about our brothers and our sisters, and we want to talk about Medicaid and SNAP from a human perspective. And with us today is Lisa Diehl, as I had mentioned earlier. And Lisa, do you want to start?
Yes, thank you, Jeff. I'd like to also thank Reverend Pastor Valerie for hosting the event today. And I am the North Central Coordinator for West Virginians for Affordable Health Care. Our mission is to bring a consumer voice to public policy so that every West Virginian has quality, affordable health care and the opportunity to lead an informed, healthy, and productive life. As Jeff mentioned, I'm going to focus on Medicaid, and I think there are some facts and figures around Medicaid that will surprise many of you. Medicaid is the single largest health insurer of children in West Virginia. It works with the CHIP program to provide families with affordable coverage for their kids, and that would include benefits that really most kids need to stay healthy and thrive. In 2016, 76% of children in West Virginia relied at some point during the year on Medicaid or CHIP, and 60% of all births in West Virginia are covered by Medicaid. Medicaid is also the primary source of health care for low-income parents and other working adults, for the elderly, and for people with disabilities. Over 650,000 West Virginians are enrolled in Medicaid, 1/3 of our entire population. The majority of Medicaid enrollees work, but their jobs do not provide health insurance. And among those who don't work, 35% are disabled and unable to work. 28% are taking care of a family member or a child at home. 18% are in school. 8% are retired, and 8% can't find work. 39,000 seniors depend on Medicaid. 130,000 blind and disabled residents in West Virginia depend on Medicaid. Medicaid pays for 76% of all nursing home and long-term care in West Virginia. And Medicaid is a lifeline for rural hospitals. Rural hospitals have always struggled. Financial status of rural hospitals in West Virginia have improved between 2013 and 2015 in Medicaid expansion states like West Virginia. Their uncompensated care costs fell 43% because of Medicaid expansion. And Medicaid revenue as a share of total hospital revenue rose 33%. Medicaid was created 50 years ago, and it has been a financial partnership between the states and the federal government. West Virginia is a poor state, as all of you know, and therefore the federal government pays 73% of our costs for health care services covered by our Medicaid program. 3/4 of all federal funds West Virginia receives are for the Medicaid program. And these dollars generate business activity and jobs both in and outside of the healthcare sector. And our rural communities need that economic activity. Current proposals in Congress would cut and cap federal funding for West Virginia, ending our 50-year-long federal partnership. Under the proposals that we've heard thus far, West Virginia would have to find more than $3 billion in state funds over 10 years to replace the loss of federal funds. And as you know, our state is already facing a budget deficit and cannot shoulder the shift in costs. Cuts and caps to Medicaid funding, as proposed, would jeopardize Medicaid programs for our children, for our seniors, for our friends and neighbors and family members with disabilities, and for all working families. No group would be safe from dramatic cuts in eligibility or benefits. West Virginians our population faces multiple high-cost health care needs, and we do have limited access to care in many of our counties. Reducing federal Medicaid funds through block grant or per capita cap proposal would dramatically limit our state's ability to deal with our high rates of obesity, diabetes, and heart disease. Medicaid is also a key tool to stem the opioid addiction crisis in our rural communities, And Medicaid pays for prevention, detection, and treatment of folks struggling with opioid abuse issues. Medicaid is a very efficient program, and it provides quality care at lower cost per enrollee than either private insurance or Medicare. There are no magic bullets that will save money in Medicaid. If the federal government cuts Medicaid funding, many West Virginians will lose their health care insurance and their access to care. To lose Medicaid funding in West Virginia would be devastating to 1/3 of the West Virginia population that depends on Medicaid. Thank you.
Seth?
Thank you, Jeff. Thank you, Reverend, and thank you everyone from leaders from the family resource community for coming out today. My name is Seth DiStefano. I'm with the West Virginia Center on Budget and Policy. I was born and raised within the Catholic social teaching of how we look out for each other. And I'd like to talk to you today about 3,600 kids. Because that's the number of kids in Marion County who rely on the Supplemental Nutrition Assistance Program, formerly known as food stamps, to have something to eat on a regular basis. We just heard a great deal about how important and vital Medicaid is to West Virginia, and it is very, very vital, as is SNAP, and what it means for those 3,600 kids here in Marion County and over 130,000 statewide. Over 30,000 seniors rely on SNAP to have something to eat. And right now in Washington, D.C., they are actively attempting to cut that so that 800 millionaires in West Virginia, that's the number of millionaires there are, can have a big tax cut. And I would just like to say that there is zero compassion in that. That is not compassionate policy making. It is compassionate to look after those 3,600 kids, to make sure they have the medical care they need, to have a fair shot at a good life, to make sure that they are well fed so they can concentrate at school, right? We know very, very well when kids go hungry, they don't learn. And if they're not learning, they're not going to be achieving later in life, right? We need to ask our members of Congress very clearly. We need to tell them about these 3,600 kids, and we need to ask them, where are you, right? Great question posed by Reverend Allen, right? There are 3,600 kids in Marion County who rely on SNAP to have something to eat. Senator's Mansion and Capito, where are you on that? Where are you? Representative McKinley, where are you on that issue? Are you on the side of compassion for them? Are you on the side of mercy? And will it show in your votes on these budgets, right? It's often said, and I believe it to be true, that if you want to know what a lawmaker values, and if you want to know what their values are, look at how they vote on the budget, right? That will tell you whose side they're on. That will tell you what they value. If they value compassion, then you don't vote to cut things like Medicaid and SNAP in West Virginia, right? If you value compassion, you stand up for those things. And you know, we're excited to be on the road. We are very excited that there is a dedicated community of West Virginians out there ready to speak from the heart about policy from a faith perspective, right? I remember during the state legislature, just as an aside, there was a bad bill that was out to cut SNAP. And I was talking and I was working with some activists in the northern part of the state, a little further north from here. And we were talking about getting active and talking with the legislature and talking about why this is bad. And I was going over some basic talking points about how SNAP is important for, you know, our economy and why it's this. And this one person told me, Seth, you don't need to talk about that with me. Jesus was very clear about feeding people. And, you know, the instructions were, there was no confusion about what Jesus had to say when it came to feeding the hungry. And a lot of that has to do, and a lot of it's going to come down to this federal budget. You know, we need to stand up for compassion, and we need to hold our lawmakers accountable for compassionate decisions. That's what I have to say. Thank you.
Okay, Cathy, and then Dee Dee, and then Jennifer will wind us up.
I'm Cathy, and I'm Reed, and I'm the president of the Greater Fairmont Council of Churches. And my concern also, just considering all the other things that have been talked about, is that when you have all these cutbacks, what about the cutbacks for the individuals that are receiving mental health services?
True.
I'm the chair of the West Virginia Behavioral Health Planning Council, and this is a great concern because Ours is a joint council. It is for behavioral health issues, but also for substance abuse issues. It's already been attributed to the fact that if you have these cuts, it's going to affect those individuals that are trying to get treatment for their substance abuse issues. It's very sad that 3,600 children in Marion County alone depend on SNAP benefits. I know from firsthand experience from helping at Energy Express for a number of years how hungry these children are, and for that program they only get the food Monday through Thursdays for 6 weeks, and then they take home a backpack. But think about the countless of children in Marion County that don't have that or don't go to schools where there's the backpack program. We cannot have our SNAP cut. We just cannot do that. And also, as been alluded to, that the elderly are affected by this. A lot of individuals, they have to decide between whether they're going to pay their bill, whether they're going to get their medicine, or whether they're going to have food to eat. I'm thankful that in our community, the Mountaineer Food Bank is going to provide a food giveaway next Tuesday, and I'm happy that Connecting Link and through the Bowers Grant, that's going to happen. But that's going to be just a one-time deal. A lot of individuals don't have access because of transportation issues to get to the food pantries, and our food pantries are stretched to a point. We have over 22 food pantries in Marion County. So if we have these cutbacks, it's going to affect individuals medically, but also physically. And if your children don't have enough to eat, then they're not going to do well in school. They're not going to get a better education. They're not going to be able to hold a good job. It's just important, and also for the mental health services. There's lots of individuals, there's cutbacks in that all the time.
Thank you, Cathy. Indeed. Okay. Jesus said that which one of you, if your child asks you for bread, will give them a stone. And so part of our SNAP campaign is called Bread Not Stones. And I see Kate Crusader back there. Kate, do you want to say? Because we are just that totally impromptu. Anyone else want to say anything at this point? Okay, everyone's eyes immediately went down at that point. Yeah. But Jesus said in Matthew's Gospels, I believe it was, that which one of you, if your child asks you for bread, will give them a stone. And I think it's a really good way to sort of symbolize what we're trying to do here, that we want to offer bread, not stones. And Jennifer, do you want to?
Sure. I want to thank everyone for coming out to be with us today. We have designed a Compassion Calls Us postcard, and we are going to send it to Senator Shelley Moore Capito. And what it states is Medicaid, CHIP, and SNAP are important for West Virginia's children and the future of our state. Please support funding for these programs, and if you'll sign them, I'll collect them before we leave today, and I will mail them to Washington in the morning.
Can we ask questions?
Sure.
Why just Capito? Why not McKinley and Mansion?
I would recommend you get in touch with all of them. I mean, at this point, I think, I definitely think that Senator Capito has the ear of the president a little bit more right now. Being that the way I look at the landscape right now, I think that they're really trying to come to some kind of consensus in the United States Senate before moving forward, especially on what's going to be this big tax package. And I think that her vote would be, her position on this issue has the potential to really, really impact what stays and what values are reflected in the budget. So I do think that there is some wisdom in making sure she is very much heard. But I mean, I wouldn't not reach out to Senator Manchin, right? I mean, Joe's been doing a good job. He really has. He really stepped up to the plate on health care, and he's made some very, very strong statements on the issue of, quote, tax reform. And it's good. And McKinley did the right thing. A couple weeks ago, Congressman McKinley, he voted no on the House budget that would have cut SNAP. It's important to make sure you call and thank them for that particular, and make sure you understand, listen, that's compassionate. That's what we expect. As far as the...
What other types of strategies do you recommend beyond postcarding and phone call?
I would recommend, after we're done today, I'd recommend, number one, you have a conversation with Kate and Amy Jo right behind you, and talk about the effectiveness of a SNAP challenge. Recently, under the leadership of these two wonderful people back there, there was a very public and very positive challenge that took place where all kinds of people in the northern part of the state started to live on $3.87 a day, which is the average amount a SNAP recipient receives in West Virginia. That's what they have to eat, $3.87 a day. And Amy Jo and Kate and a bunch of other people got together with Catholic Charities and Our Children, Our Future and took this challenge publicly, right, and publicly engaged Congressman McKinley to say, this is what it's like, this is what it looks like. They were on Facebook, you know, clear pictures of this is what I have to eat today for $3.87. Why don't you take this challenge with me, right? And then it'll put in perspective when you're put into a position to potentially cut SNAP in favor of, big tax cuts for the wealthy. I think that was a very, very effective strategy.
And I think also, I think it was what Jennifer was saying, is that, people need to begin to speak from their heart. A lot of people will have a parent or a child on Medicaid, someone who might be, who might need skilled nursing or other services. And, we need to start talking about people in terms of these debates. We've got to move away from the ideological debate, which is just tearing the country apart. And we need to move away from just a strictly economic debate, because I've always, whether it be the church budget or the federal budget or state budget, we find money for what we feel is important.
It's true.
And
very true.
And our children and our seniors and our disabled are important, and they're important in God's eyes. And so I think, in thinking about the people in one's own life who are affected by these, or your neighbor's life who are affected by these, writing an op-ed, writing a letter to the paper, just, talking to your neighbor that, when the particular issue comes up, maybe there's another way to look at this, and maybe, my aunt or uncle or parent or child, is impacted by this program. And beyond that, we believe that every human being is created in the image of God and needs food and medical care. And just to sort of come back to these biblical roots of compassion and justice and mercy. So that would be, that's what I would say.
So your loaf of bread there represents what?
In the Bible, when Jesus is speaking, he talks about, which one of you, if your child comes up to you and asks for a loaf of bread, would give them stones? And too often, I think we might be giving our children stones these days rather than the bread that they need for sustenance. And the bread also sort of also symbolizes our connection between various communities. This bread comes as a gift, and it's from Charleston. And in a moment here, we'll sort of gather around this and say a prayer over it, and then we will share this bread and remember that we're just so connected in so many different ways. And I think it symbolizes connection and nourishment, as opposed to the stones that we're just all too often eager to throw at one another. And so it's just a gift.
Your other Compassion Caravans are going to be where, or how many have you already had, or when are they going to be, so that maybe people can get it out there better? I know this was on Facebook, but in a better, timely manner for other people in the state.
So we want to go to every part of the state. We've been to Parkersburg, and some of our next, we're hoping to go to Wheeling, if not next in the near future, but Morgantown, Martinsburg, Buchanan, hopefully McDowell County, possibly Keystone or Kimball, and then to Huntington, and then back to finish up in Charleston. And we do have a Facebook page now.
Yeah, we do.
Is that
Yeah,
right?
there's a Facebook page. We use the events function to help get the word about when they get organized and when we.
Because I know Dee Dee's did a pretty good job of trying to advertise. Dee Dee did a pretty good job of trying to advertise it here in the Fairmont area and then it was mentioned at our FRN meeting that was going to happen. So.
My other concern is with the benefits being reduced, perhaps eliminated, what it does, as you mentioned, Seth, to the education process. Because already we see West Virginia students who flunk out of school. We have a high rate of dropout, the highest rate in the nation percentage-wise of West Virginia students going to prison because of lack of jobs or lack of adequate nutrition. So this seems to be another talking point that is very, very crucial that we kind of, glossed over in terms of providing money for the wealthy. And if that reduction of the taxes occur in Congress, my understanding is that the tax is going to go from like 39% for the wealthy down to 20%.
Yeah, I mean,
and then the people who's going to be hurt will be all the other ones of us who are going to be asked to do all of the non-essential military programs.
Absolutely.
Want to be enacted by the president.
Well, I think too. I mean, I think the best description, of this, I heard from a doctor at Marshall University, that if you're a child and you're living in substandard housing and you don't have enough heat and it's the winter time, you're burning a lot of calories, at night, just as in the normal course of trying to sleep, and so you wake up and you're needing food, and if you cut school breakfast, or if you cut school lunch, or if you cut the other assistance that you have that comes from SNAP, I mean, children just burn it seems to me an incredible amount of calories. Those of you with teenagers might bring in on that, but when you're for someone who is elderly, I mean, as a mission project director for 13 years, you would be, many of the elderly in this state are struggling and are dependent upon food stamps as well. I mean, these are vital programs for people in terms of their just, basic human survival. And, it's something that just shouldn't even be on the table at this point. Where, we need to find ways to fund this, not cut it, because there's, food pantries, I think, are doing an excellent and wonderful job in the state, but to absorb the number of people who would, who would need additional food in that, I think would be, a huge challenge. Kate or Amy Jo, do you want to say?
I don't think so.
I was telling Kate, we had lunch together, and I said my mother is 71 years old, and she's never been quote-unquote political before. She's never spoken up. She was never raised to speak up. But she called Capitol the other day when I said, Mom, your Medicare's on the line. She's going to mess with your Medicare. And so I told Kate, I was like, my mom's 71 years old, and she just had her first taste of activism. But, I mean, because she said they've already raised my Medicare, I can't afford anything else. And I said, then it's your job. It's your responsibility to speak up for yourself and follow our telegram. So I think that's, and it's kind of scary and intimidating if you're not used to doing that, but all it really takes is a simple phone call, 2 or 3 minutes, and you can at least have your piece said.
Yeah.
And most legislators, I think, are open, to those phone calls. They want to be on good terms with their constituents, and it's just so you don't have to be rude. Just very politely say, this is an issue that's really important to me, and just speak from the heart, and the word will get out, and they will hear. Lisa, do you want to say anything?
I think everybody's covered many of the things that I would say, but I would also suggest that people educate themselves. Understand what the impacts are going to be to your family member, friends, family, whatever, and make sure you have accurate information about these programs and what the cuts are really going to mean.
Are there other questions, either from the media or questions or from the audience? if not, why don't we gather around the bread, and I'll ask Pastor Val to start us off with a blessing, and anyone else who wants to say a blessing on this bread to join in. And you should come forward. Yeah, let's just make as best we can. That's where. Yes, you're good. That's just enough. Oh, we have one person coming in.
I think he's taking a picture.
Oh, you're going to take a picture? Okay.
Let's pray together.
Okay.
Almighty and eternal God, we give you thanks for this day, for this time of education, for the opportunity to learn more and to be challenged, to be compassionate. Lord, you've given us the command to usher in your kingdom. And in your kingdom, surely there is not one hungry child. So let us do what we can to promote this compassion, to be sure that our children and the sick and the elderly among us who are vulnerable will receive the best care they can receive. Lord, put it in each one of our hearts, that responsibility. We give thanks to Lord for this bread, and we ask that you bless it and bless us. In Christ's name. Amen.
Lord, humbly we come before you. We do thank you for this bread. We thank you for those who have cared enough to come here. We thank you for your great compassion that you have for us. We pray for those who suffer, who are hungry, who are mentally ill. We pray that their services will not be cut. And we give you all this thanks, Lord.
Shall we eat? Yeah? Sandwiches?
Your lunch is ready.
That's great. Okay, good.
Coffee, water over there.
And if